Welcome everyone. Today we're diving into an exciting and innovative treatment for benign prostatic hyperplasia, or as most of us call it, BPH. And it's Optilume. We'll explore what it is, how it works, and why it just might be the future of minimally invasive therapy for enlarged prostates. So BPH simply means your prostate is growing larger, but not because of cancer. This enlargement presses on the urethra, causing bothersome urinary symptoms. If you experience slow flow or getting up at night often, you're not alone. Millions of men share this experience. And as you can kind of see from this prostate, see how as it starts to enlarge, it starts to compress the urethra, which is the tube that we urinate through. That's the bladder up there that holds the urine. Now, over the years, we've had several approaches to treat BPH. Medications can often relieve symptoms, but they don't stop the prostate from growing, and sometimes cause side effects like dizziness or sexual dysfunction. Also, a lot of patients, we've done studies to show this, just quit taking the drugs. They get tired of taking medicine. So it's a compliance issue too. Now, surgical procedures are effective, but are invasive. However, it gets rid of the patient having to decide whether they're going to take a pill every day or not. So compliance becomes much better with surgery, of course. But now that's where Optilume enters the scene with the minimally invasive options. So Optilume is a novel approach that combines two powerful concepts: a balloon to open the urethra, compressing the prostate, and a medication that keeps it open. Now, I've been in urology for 40 years, and they were ballooning prostates 40 years ago. It just never worked because it wouldn't stay open. Body heals everything. Now, this dual action technique, though, makes it both immediate and lasting with kind of a minimal downtime. So let's talk a little bit more about how that works. So we can see from this picture, here's how it actually works. Your urologist inserts a small balloon into the urethra, right where the prostate causes blockage. Once inflated, the balloon opens a narrowed area, and the medication, paclitaxel, is released. That's the whole key. That prevents scar tissue that could cause future narrowing. So as we can see from our picture here, nice picture, how nice and open that hole is after the ballooning is done. Now, I've got a little picture or a little video I'm going to play for you from the company that produces this one called Laborly. So let's go to that. So as we can see, here's their video. This kind of shows it's done with the scope, a cystoscope placed into the bladder. A little anesthesia used for this. And then the balloon on the top, it's a double balloon, as we showed in the beginning. The top balloon is inflated. That is a positioning, making sure that it's in the right place. The second one is the dilating one. So that's the one opening up the prostate. And you can see that they're animating that's delivering the medication to keep it open. Once that's done as compression, it's simply removed, leaving that nice open area for better release of the symptoms. Relief, not release. So what are the benefits? Optilume offers several key benefits for men with benign prostatic hyperplasia. 1, it's minimally invasive. 2, it's an outpatient procedure. 3, it provides significant symptom relief without the need for major surgery or an extended recovery. The innovative combination of the mechanical dilation and drug-coated balloon technology helps open the urethra and preventing that tissue from narrowing again, promoting a lasting result. Many patients experience rapid improvement in urinary flow and quality of life while preserving sexual function better than traditional surgical options. Maybe I should address that sexual function issue. So the traditional, what we call gold standard, is to kind of go in there and scrape out the tissue. When you do that, you're left with an issue called retrograde ejaculation. Now, it doesn't mean that you can't get an erection. It doesn't mean that it's going to prevent you from ejaculating or having a climax. However, no fluid's going to come out. Now, for some men, they really don't care. And if you're beyond having children, that's not an issue. But for some people, they really freak out about the fact that nothing's coming out of their penis when they ejaculate or climax. That's what they're referring to about the sexual function. So with the traditional procedures, that's going to be gone. But Optilume does have the option, or does tend to have the ability to still preserve that. So overall, Optilume represents a safe, effective, and convenient alternative in modern BPH management. Now, like any procedure, Optilume is not without potential side effects. Everything sounds great until you have it done, right? As I always say, everything is great if it's somebody else, but when it's me, it's not. So I got to worry about things. Most are mild and temporary, such as burning, light bleeding. Now, you talk to your provider. They'll discuss in details with you before your treatment what you need to know. Now, things like, are you on a blood thinner? You can't be dilating and ballooning things while you're on a blood thinner. You would bleed more. So talk to your doctor about your medications and make sure that you're a good candidate for this procedure. You want the best result. So Optilume, excellent option for men with moderate symptoms, benign BPH, who want meaningful relief without major surgery. It's particularly suited to patients who haven't responded well to medications or prefer minimally invasive outpatient treatment with a quick recovery. Ideal candidates typically have prostates of moderate size and no severe obstruction or complicating health conditions. Men who value maintaining sexual function and wish to avoid more invasive procedures like that TURP I talked about earlier, or laser surgeries, may find Optilume a great fit after consultation with their urologist. So what should you expect? After treatment, most men go home same day. They can return to light activities quickly. A catheter might be used briefly, and within a few weeks, many patients notice significant improvement in their urinary flow and comfort. So what's the future of BPH care? Well, just so you understand, the development of Optilume for BPH stems from the success of a similar drug-coated balloon technology, first used for urethral strictures. Those are when you get these scars that form in the tube that you urinate through. And I just talked about that one. Building on that innovation, engineers and urologists sought a way to combine mechanical dilation with localized drug delivery to improve outcomes for men with prostate obstruction. So Optilume was designed and clinically tested to deliver that paclitaxel, the drug that helps prevent scarring and re-narrowing, same one used for the urethral stricture, directly to the prostatic urethra. Early clinical trials demonstrated strong safety and efficacy, leading to the FDA to approve this in 2023. Now this is 2025, so it's only been around a couple years. We always like to see 5-year data, but somebody's got to get the procedure done to get 5-year data, right? Since then, Optilume has gained attention as a breakthrough, minimally invasive option for men seeking durable symptom relief without compromising sexual function. So in summary, Optilume is an innovative therapy giving men another great choice for managing their BPH. Quick, safe, and may offer long-lasting relief. Now, why do I say may? Because, again, 5-year data, that's what I look for. How well does it hold up over time? We don't know yet. Only been a couple of years that it's been FDA approved. So we'll know better as time goes on, but I think it's going to be one of those winners. Always discuss with your urologist whether it's a good fit for your unique situation. The nice thing is we've got lots of options, as you probably find out from watching our show. So not one procedure fits everyone. So, depending on your prostate size, other medical history that you have, this could or could not be a good thing for you. All right, so thanks for watching and joining me today. I hope this session helped you understand what Optilume is, why it's such an exciting step forward in BPH treatment. Be sure to subscribe to my channel for more patient-friendly education and updates from UroPatient. From research